Today, we'll talk about hospital-acquired infection. They're also called as nosocomial infection. Hospital-acquired infection. They are also called as nosocomial infection. Comion means hospital. Noso. They're also called as nosocomial infection. They're also called as hospital-acquired infection. They're also called as nosocomial infection. Hold it like this. There are four hospital-acquired infection. Number one, Cauti. Cauti stands for catheterized, catheter acquired urinary tract infection. Catheter acquired urinary tract infection stands for Cauti. The second one is VAP, ventilator associated pneumonia. Ventilator associated pneumonia. Ventilator associated pneumonia. Number three, surgical site infection. Number four, BSI, bloodstream Who said this? Please don't do any harm to already sick patient. Florence Nightingale. Patient comes with diabetes, blood pressure, fracture neck femur, so many other problems. Should not give all this super added infection. So it's very important. We should be very careful that we should not give. Usually, patient goes on catheter post-operatively. We should be very careful. Usually, we calculate number of days patient on calculator, percentage of people who are infected with the urinary tract infection after passing the catheter. VAP, number of days on ventilator, and pneumonia following the patient put it on life support system ventilator. Post-operative wound infection is also called as surgical site infection. Very important. Surgeon has to be very careful about this surgical site infection. Then bloodstream infection through IV fluids and sometimes we do blood transfusion and so many things. So patient may get infected with the through the IV line. So all these four are very important nosocomial infections that we come across. Infection acquired in the hospital by a patient admitted for the reason other than infection. Okay, infection not present and should appear. So what is the time? That within 48 hours of the after hospitalization. Within 48 hours after the hospitalization. It's very important. Infection acquired by symptoms appearing after discharge also, and needle secure injury also included in the an occupational hazard. NSI can include NSI also, hospital acquired infection, needle sick injuries. So that's a lot of important things in hospital that can occur due to the now if the patient is immunocompromised, chances of getting hospital in HIV patients or cancer patient or patient on renal dialysis. So all this patient immune status is important. There are chances of these people getting infected with the infection during their hospital stay. Next is hospital environment is full of, first is immune status, second is environment, hospital environment. Hospital environment, hospital air is full of microorganisms which are multi-drug resistance, MRD, multi-drug resistant, MDR. And we take blood for diagnostic purpose. Through the needle, you can introduce the organism. Therapeutic interventions, we do PEG, then we do Braille's tube. So many things we put. Blood transfusion, poor hospital administration. Hospital is not clean, if it is dirty. The patients are the chances that you will get infected. So sometimes due to endogenous source as well as exogenous source. What are the endogenous sources that patient get infected? If you patient gets infected by do a colorectal surgery on the intestine, you may get infected with the organism present in the gut. Exogenous, I said, hospital air full of multi-drug resistant organism, air, water, and food, anything. Healthcare workers, hands of HCW. So you should follow the protocol of hand washing. And some people, hospital healthcare workers may carry MRSA. MRSA stands for methicillin resistant Staphylococcus aureus. Methicillin resistant Staphylococcus aureus. It's only sensitive to vancomycin and linezolid. Only sensitive to only sensitive to only sensitive to vancomycin linezolid. There is a cross infection. If beds are put very near to each other, chances that patient may get acquired infection from the next patient, hospital acquired infection. So these important organisms escape. These are the organisms which commonly cause hospital acquired infection. Remember with mnemonic escape. What is escape stands for? First one is Enterococcus faecium. Enterococcus. Enterococcus faecium. Next is Staphylococcus aureus. Third one is Klebsiella pneumoniae. The fourth one is Acinetobacter. It is very important. Pseudomonas. Pseudomonas aeruginosa. The fifth one is Enterobacter. Enterobacter species. These are called as escape organisms. They are present in the hospital environment. Enterococcus faecium is comes under group D streptococci. Group A is Wildans, group B is group B, beta hemolytic streptococci. D is gamma enterococci, Enterococcus faecium, fecalis and faecium. Staphylococcus aureus, MRSA. A lot of hospital healthcare workers are carrying this microorganism in the nasopharynx. But to periodically do the survey of healthcare workers, where they are carrying their uh, microorganism in their nose and throats. Klebsiella pneumoniae, again an important organism, which produces nuclearly beta lactamase resistant to meropenem, imipenem. Acinetobacter, again very common organism in the hospital environment. Pseudomonas aeruginosa stands for blue pus. Again, it's MDR, Enterobacter species. All these are very important in the causation of hospital acquired infection. Okay, moving on to the Now, infections spread in the hospital include E. coli, SARS, COVID-19, nosocomial acquired infection, sometimes tuberculosis, because it's present in the air. Then Legionella pneumophila, Candida albicans, Clostridium difficile, because overuse of antibiotic. Bloodborne infection. If you do not screen the blood in the blood bank, the chances of getting hepatitis B, hepatitis C, and HIV. Due to mode of transmission is due to contact transmission, droplet infection, airborne transmission. The first one is there are four common types. That's I said catheter associated urinary tract infection. Cauti. Cauti stands for catheter associated urinary tract infection. 33% of the patients who goes on catheter will get infected. Next one is BSI. That is about 13%. BSI, bloodstream infection, about 13%. It is central line associated bloodstream infection. CLABS, it is also called CLAB BSI. CLAB BSI. Ventilator associated pneumonia, VAP. VAP is about 15%. And SSI, surgical site infection, with the postoperative wound infection is 31%. Postoperative wound infection is about 31%. So there are four major type of hospital acquired infections. The first one is catheter associated urinary tract infection, which occurs in 33% of patients. The second one is central line bloodstream infections that occurs in 13% of patients. The third one is ventilator associated pneumonia, which occurs in 15% of the patient. The third one is surgical site infection, which occurs in 31% of the patient. So please remember, hospital acquired infection is very commonly asked questions in your theory examination. Please remember, everybody repeat with me. Cauti. Cauti stands for catheter associated urinary tract infection. It occurs in the 33% of the patient who goes on catheter. 33% of the patient who goes on the. It's very high actually, 40. Next is central line associated bloodstream infection. Remember it as VSI, okay? About 13%. Then ventilator associated pneumonia, it's 15%. And surgical site infection is almost 31%. So repeat with me. The Cauti, catheter associated urinary tract infection. BSI, bloodstream infection. This is due to central line, IV fluids. The third one is VAP, ventilator associated pneumonia. Ventilator associated pneumonia. The fourth one is surgical site infection, SSI, surgical site infection. The preventive measure first broadly categorized into standard precaution, transmit-based specific precaution. So what are the standard precautions we take? And transmission-based precautions. Standard-based precautions and transmission-based precautions. So what are they? How do you prevent this hospital-acquired infection? How do you prevent this bloodstream infection, surgical site infection, catheter-associated urinary tract infection? Standard precautions. To prevent transmission of disease, the measure should allow when providing a care. It should be all people who are present in the hospital should participate in infection control. All individuals, blood and body fluid, all needle sharps. Universal precautions. It's not been used. It is now recoined as PP, personal protective equipment or something like that. First is hand hygiene, hand washing. It was discovered by Ignaz Samuel Weiss. So there is a standard how to use soap and water. The 6 steps of hand washing, do it 6 months hand washing. Everybody should carry alcohol-based hand sanitizer to your hospital. before touching the patient, after examination patient. Start doing hospital hand washing technique. Show now. Number one, number one, number two, number two. Nee, that is not number two. Number two. Number three is this. Number four, number five, number six. These are 6 steps. WHO protocol. PP, personal protective equipment. You should have a cap, mask, goggles, protective apron, gumboots. Biomedical waste management. There are color codes used by biomedical management. Sharp are disposed in which colored bin? Sharp, sharp needles. Which colored bin? Sharp. Sharp colored needles, scissors, or anything used. So remember, sharp for white. White puncture proof bin. White. White for sharp. Sharp in Telugu, what is called sharp? Needles, what do you call? Suji. Sudi. White. Huh? Spell. Spelling of white in Telugu. Okay. Now next is yellow. Yellow, dirty fellow. All infected plastics, tubings, gloves, infected material are all discarded in the yellow. Human anatomical waste. Most important human anatomical, after the delivery, what comes out, you throw in this bin. Placenta, dead fetus or biopsied material, everything is thrown in the yellow color. Next is blue. Blue color also, infected material is thrown blue color, and especially you remember blue color for glass. How to remember blue color for glass? So you imagine yourself sleeping on a starry night, full moon day, and you have got a glass roof and you're seeing a star in a blue sky. So all glasswares which can be reused are disposed in the petri dishes, syringes without needle are stand in the. Next is red. This is human anatomical waste. Red you should remember with the parrot beak, which is red. Again here all infected material. Here it is anatomical waste. Here it is plastic are also. You don't remove the here. Here it is put parrot for plastics. Remember parrot, red color beak and plastics. Gloves are disposed in the red color bin. Then last one is black. Black is non-infective waste, like which you can give to the municipality. I mean, paper, non-used anything, which is non-infective waste. Okay, the first one is white. White is used for needles and sharps. 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 Yellow is for all infected materials, human anatomical waste, all unused drugs are used for yellow. Blue for glasswares. Blue for glasswares. Red for parrot. You remember red for parrot. You remember all plastic disposables are used in the red. Then last one is black. Non-infective waste is disposed in the black color. So these are the color code that we use in hospital waste disposal. Biomedical waste. It is called as biomedical waste. Let's sit properly. What is this? Sitting in theater or what? Sit properly. Then spillage cleaning. If suddenly you drop some blood or body fluid on the, how do you clean the droppage on the? You have been taught how to clean that. Use mop it nicely with the sodium hypochlorite solution. Put sodium hypochlorite solution, leave it for some time, then clean it. Disinfection of patients' care items, environmental cleaning, respiratory hygiene, cough etiquette. Always, whenever you get cough and sneeze, you go to the corner, do and say excuse me and all those things. Don't act, don't do that. You should be very careful and respiratory hygiene and all. So safe use and disposal of sharp. It's very important. In one hand technique, when you using the syringe and you want to put the cap back, you have to use only one hand. Put back your needle. Once it goes inside the cap, then one hand lock technique that has to be done. Or better way is in most of the hospitals that the needle burners are there. You burn the needle, then that gets care. All these things should be followed. This color code is very important. Again, it is asked in the biomedical waste management in your examination. Hands of healthcare workers are the main source of transmission. So always, whenever you are going to go to the hospital, you should carry um, hand alcohol-based hand sanitizer. That's very important. Hand hygiene, most important measure to prevent healthcare-associated infection. Hand rub, alcohol-based hand rub, 70 to 80% ethyl alcohol, chlorhexidine, 0.5 to 4% based. Duration, you have to use, put the watch, you have to wash your with hand rub that 20 to 30 seconds. So after contact, it gets evaporated on its own. You need not have to go to the water if there is no water or basin available, water basin available. Sink is not available. During routine patient care activities and taking the rounds. Hand washing, antimicrobial soap, liquid gel or bars or ordinary soap or water. It should be done for 40 to 60 seconds. When hands are visibly soiled with blood and excreta plus before and after eating, after going to toilet, before and after duty, when cleaning, caring diarrhea patient. All these things, hand wash should be done for each and every step. It's very important. Hand washing is the first step discovered by Ignaz Samuel Weiss. When he saw that patient, students coming from hospital, dissection and students coming from nursing school, both of them conducted deliveries. There was less number of postpartum sepsis, post-delivery sepsis among the students coming from class compared to the people coming from the student coming from the dissection hall. He said simple hand washing with soap water reduce the postpartum sepsis. But his work was not recognized. Ultimately, he died in the mental asylum. Surgical head rub, hand rub consists of chlorhexidine, 4%. Duration, during operation you have to be very vigorous. have to wash more times so that all the organism present in the hand should not go into the patient's body. Prior to the surgical procedure, in between cases, you should rub your hands. It's very important. So these are the steps. Number one, you do it again. Number one, number two. So put first soap and water, then palm and this thing. Number two. Step number one. Step number two. Step number three. Step number four. Step number. That is how you put your uh, single hand use towel. Okay. These are the various steps in hand hygiene. Uh, thumb should be rubbed in between the palms should be rubbed. It's very important. Use of protect skin and mucous membrane of healthcare workers from exposure to blood or any body fluid. From healthcare worker to the patient during sterile and invasive procedures is very important. So, personal protective hygiene (PPE) is all you use during hygiene. First one is gloves. Second is heavy duty gloves. Third one is surgical mask. These N95 respirator. Then plastic apron, linen gown, and then coverall, goggles, face shield, cap, shoe cover, gumboot, everything you should use. This is called PP, personal protective equipment. Personal protective equipment. It's very important. So, how to putting up the gloves is called everybody. Putting up the gloves is called donning. Putting up the gloves is called as donning. Removing the gloves is called as doffing. Removing the gloves is called doffing. So donning the glove, wear by touching and pulling the only one edge of the cuff. Donning the second gloves, avoid touching the forearm skin by pulling the external surface, second glove, by finger gloved hand. So do not touch the outside the gloves. Using gloved hand, grasp the palm the area of other glove, hand peel first glove, hold the removed glove in the gloved slide, finger is ungloved hand, other glove at wrist and peel off the second glove over the first glove. First glove will remain inside the pouch for the second glove. Perform the hand hygiene after removal. That is doffing also. That is doffing. Okay. Respiratory protection, surgical mask and respirators. Respiratory protection is essential when there is a risk of transmission by, that during COVID. Still, you are all using the mask because of droplet and aerosol infection. There are two types of personal protective equipment available for respiratory protection. One is surgical mask, what you are wearing, another is respirators. The surgical mask, pull the straps tight, pull the mask below the chin, apply the knots. Press the bridge of the nose of the mask, seal tightly, and N95 respirator, perform the fit check. And do not touch the part of the mask, untie the lower mask, upper knot, and remove the mask by holding, and it straps without touching the front, and hand wash after removal. What happens? Most of you are using you are using for just namesake. I don't know. Most of them, when they get cough and cold, they'll then they put it. It's not the way of doing it. Okay. Now, the respirators are devices protect the wearer from airborne microorganisms, especially mycobacterium. N95 respirator most commonly used. N95 not resistance of to oil and ability to filter 95% of the airborne product. 95% protective. That's why it is called as 95. Fit checking to ensure the properly fitted include the following steps. Sealing across the face, check the nasal bridge, positive pressure seal, done by gently exhaling, done by gently inhaling. Fit testing, done to identify the size and style, train the healthcare workers how to don and doff, should be done at the time of joining and thereafter annually. Or when where the risk of clothing may become laboratory coats, plastic aprons, disposable gowns, and coverall. The steps of gown wearing: fully cover torso, check the knees, arms to end of the wrist, wrap around back, fasten the neck, and remove the waist. They do not touch the front of the gown, unfasten the ties, taking care sleeves do not touch the body when reaching the ties. Pull down the gown away from the neck and should wear touching inside of gown only. Turn around the gown inside out and roll into a bundle of discard. Perform hand hygiene after removal. Goggles are very protective because some of the organism enter through your conjunctiva. You have to wear, even if you are not have numbers, you have to wear them and cover them with used to protect mucous membrane of the eyes, nose, and mouth. That is goggles. Eyewear during the procedures that is likely to get droplet aerosol infection, blood, or high risk body fluids. Gum boots, surgical shoes, and gum boots when anticipated there is a sharp injury that exists. Donning and doffing: donning is wearing, doffing is removing. Donning everywhere. Donning is wearing and doffing is removing. Gown first, mask and respirator, goggles, face shield, gloves. That's in order you have to remove. That's in order you have to wear. First you wear respirator, then goggles, face shield, gloves. Removal: first you remove the gloves first, then face shield, then goggles, gown, mask, respirator. Discard PP in appropriate biomedical waste bin. PP should be removed just before exiting the patient room except respirator. It should be removed only after leaving the patient room and closing the door. Which of this is not a escape organism? Enterococcus faecium, Staphylococcus aureus, Klebsiella pneumoniae, Proteus mirabilis. Thank you. Any questions? If you have any doubts? So please remember the hospital acquired infections are four. Okay. One is Cauti, catheter associated urinary tract infection. Second one is VAP, ventilator associated pneumonia. Third one is surgical site infection. The fourth one is BSI. The first step of the hospital acquired infection starts from hand hygiene. You have to wash your hands using soap and water or alcohol based hand sanitizer. That's very important. You have to use it, you have to wash your hands before touching the patient and after touching the patient. That's very important. And you should not get infected by the needle stick injury in the hospital practice. If you get needle stick injury, immediately you should report to the microbial diagnosis. Anti-HIV treatment should be done. Post-exposure prophylaxis, we give anti-HIV drug. It should be started within 48 hours of your needle stick injury. If anybody of you get needle stick injury during your course, it should be immediately reported. There is an infection control department. It should be reported to them. That's very important. Okay. The three important viral diseases that are transmitted by needle stick injury are, what are the three needle stick injuries that are transmitted by hospital acquired infection? Needle stick injury, what are the three? Hepatitis B, repeat with me, hepatitis B, hepatitis C, and HIV. These are the infections that are transmitted by the needle stick injury. Okay, you should be very careful. You should not, because we're all going to be technicians, because you use sample collection, no? Where you go for sample collection. The chances that while putting back your syringes, as far as possible, you burn the needle. Don't avoid recapping the needles. As far as possible, avoid recapping the needles. So there is a needle burner. Even if needle burner is not there, you should use the uh, one hand lock technique. You'd see that the needle goes inside the cap, afterwards lock it. All plastics are discarded in plastics discarded in which colored bin? P for parrot, P for red. Plastic for parrot. Okay. All plastics are discarded in red color. All glasswares are discarded in blue color. Starry sky with sunglass roof. All sharps are discarded in white puncture proof bin. Yellow, all human anatomical waste. All human dead fetus, placenta, appendix, biopsy material, all should be discarded in yellow. All non-infective waste should be discarded in black color. All non-infective waste should be discarded. So that's a very important part and parcel of this thing. So of course you are not doing catheterization or you are not doing, but you are drawing the samples. Drawing the samples with needle and syringe. You should be very careful that you should not get needle sick injury. So if needle sick injury occurs, immediately you should report to the infection control department, where you are screened or the source also screened for HIV, HBsAg and HCV, hepatitis B, hepatitis C and HIV. If you are if the patient is source is known is HIV positive, immediately we start anti-HIV retroviral drugs prophylaxis. And if the screen for HBsAg positive source, then we are periodically we have to do your liver function test, antibody titers, and it should be administered. If your titer is less than 10 IU per ml, then you have to need a booster dose and anti-human gamma globulin against hepatitis B. HCV again you have to take. It's a very important important infection transmitted by needle stick injury. So you should be very careful while working in a hospital, especially in sample collection area and while doing the procedures also. It's very important. Okay. Next is personal like protective equipment. We have the gloves, the heavy gloves, and goggles, and masks, surgical masks, and, gum boots, aprons. So as far as possible, you should not get infected when important organisms that are hospital environment and multiple organisms get infected. That's very important. What are the organisms that cause urinary tract infection? Name the organism. UTI, urinary tract infection. You should remember with mnemonic keeps Klebsiella, E. coli, Enterococci, Enterobacter, Proteus, Pseudomonas, Staphylococci, remember it as mostly it is coagulase negative Staphylococcus. Remember with this mnemonic Klebsiella, Klebsiella, E. coli, Enterobacter, Enterococci, Proteus, Pseudomonas, Staphylococci, especially cons, coagulase negative Staphylococcus. Coagulase negative Staphylococcus. How do you do coagulase test? All these things are asked in your examination. Coagulase test. Which organism produces coagulase? Which organism produces coagulase? Hmm? Huh? Which organism? Staphylococci produces it converts fibrinogen into which converts fibrinogen into fibrin, forms the barrier around the organism. Prevents phagocytosis and it advantages to human being also. All the staphylococcal lesions are localized. Okay. So you remember staphylococci with two C's. What is two C's? It is catalase positive. How to do catalase test? Catalase, difference between catalase and staphylococci is catalase positive, streptococci is catalase negative. So it breaks the hydrogen peroxide water and oxygen. It breaks the hydrogen peroxide into water, H2O. And so when you pour hydrogen peroxide on the broth culture, there will be bubbling, nascent oxygen. That is catalase test. There are two types of coagulase test. One is bound coagulase test to detect the bound coagulase. Another is tube coagulase test. Bound coagulase and tube coagulase. Bound coagulase, you take saline suspension of organism, add plasma, undiluted plasma. There will be clumping of the organism. This detects the coagulase which is bound to the cell wall of the staphylococci. It is bound to the cell wall of the staphylococci. Bound to the cell wall of the staphylococci. Tube coagulase test for the free coagulase. Take 0.5 ml of broth culture, 0.5 ml of broth culture, add 0.5 ml of plasma. Incubate at 37 degrees centigrade for 4 hours, and there is a formation of coagulum. There is a formation of coagulum at the bottom of the tube. There is a formation of coagulum at the bottom of the tube. And in addition, it needs CRF for the precoagulation. CRF stands for coagulase reactivating factor. CRF stands for coagulase reactivating factor. So important biochemical tests, all technicians should know all the biochemical reaction which we do in the practical hall. The concave medium consists of what? Remember, it's mnemonic plant. Okay, P for peptone, L for lactose, A for agar, neutral red, and taroconate. So it differentiates between LF colonies and NLF colonies. Differentiates between LF colonies and non-lactose fermenter colonies. Lactose fermenters and non-lactose fermenters. Lactose fermenters colonies are pink in color. Lactose fermenter colonies are pink in color. Example of lactose fermenters are E. coli, Klebsiella. Example of lactose fermenters are E. coli and Klebsiella. Non-lactose fermenters are Salmonella, Shigella, Proteus, and Pseudomonas. They are pale or colorless. They are non-lactose fermenters. They are non-lactose fermenter. They are non-lactose fermenter. You don't know to laboratory posting, you are not posted in microbiology. How many of you are posted in microbiology? 1, 2, 3. You are not seeing how culture is done. Okay, how sample is processed, how we do antibiogram. You don't know. You are not seeing. There is something like you put it on. These are called MMTP reaction. This is mannitol motility. This is TSI. This is peptone water. Plus we do catalase. Oxidase. The mannitol motility is done to detect the fermentation of mannitol and detection of motility. Mannitol motility meaning. Triple sugar iron agar dispensed in. It's a composite medium. It has got butt and a slant. Triple sugar means 3 sugars are there. Sucrose, lactose, glucose. How many sugars? 3 sugars. Sucrose, lactose, glucose. And it has got ferrous ammonium sulfide as a which shows production of H2S. And if there is a bubbling, then it shows production of gas. So then peptone water we do to indole test. Indole test is conversion of tryptophan, amino acid tryptophan in gas called indole. So we add our overnight broth culture, we put it in peptone water. Overnight broth culture, we add Ehrlich or coax reagent. There is a formation of pink ring. At the junction of the tube. That is indole positive. E. coli is indole positive, whereas Klebsiella is indole negative. Klebsiella is indole negative. Now, these are the basic thing: catalyzed acid, hydrogen peroxide. You can see the bubbling of the nascent oxygen. Oxidized in this is tetramethyl, paraffin, diamine, dihydrochloride. Everybody replied tetramethyl, paraffin, diamine, dihydrochloride. Tetramethyl, paraffin, diamino dihydrochloride. You prepare 1% of the fresh solution and rub it on the filter paper colonies, and there will be change of color, purple color. Then that is oxidase positive. Oxidase positive. Pseudomonas is oxidase positive, and all enteric organisms are oxidase negative, catalase positive. All enterobacteriaceae are oxidase negative and catalase positive. Oxidase negative and catalase positive. Oxidase positive. So these are the basic. Mannitol motility shows fermentation of fermentation sugar mannitol and motility. If organism is grown in zigzag pattern like this, then it is motile, and change in the color shows mannitol is fermented. 3 sugars are there: sucrose 10 parts, lactose 10 parts, glucose 1 part. So if you see a uncolored, not color change in the, no color change in the plant, but it is color change here, then glucose is not ferment. We write it as A by K, K by A, K by A. So triple sugar, and if there is a blackening here, that shows H2S positive. Okay. So MMTP reaction we usually put. So nobody taught you in the practicals how various the moment urine comes, how it is processed, how it is put on McConkey's medium, how reading is taken, whether it's LF and NLF. From the colony you have to do a gram stain, then identify the organism, then you put a MMTP reaction, then put the antibiotics, and next day you look for the zone of inhibition. Depending on the Kibri-Bayer's chart, you measure the zone of inhibition depending on the Kibri-Bayer's chart, whether which is positive, which is negative. Then you have to give E. coli isolated and sensitive or resistant to so many things. So all day, every day you should learn all this serology, everything you should learn. Just going there and spending time is no use. You have to learn. We are not going to become technicians. Simultaneously learn all the subjects. No, it's very important. Microbiology is a very specialized branch. Become a good. If you learn culture and synthesis, a lot of people do not know how to do culture the organisms and give good antibiogram report. If you learn that perfectly, then you will be get a good job. I mean, you are suitably employed in the best place. So I think you should when you go to the hospital. What time to what time you go to the hospital? Lab 2 to 4. 2 to 4 you are in the lab only. You don't go anywhere. Be there. Learn no. Raju is processing all the samples. No. You ask him what he is doing, how he is processing. When next day when in the morning you are not there. You pick up on culture plate and see what antibiotics are dispensed and what is zone of inhibition, how it is measured, how the reports are gone. Look at it. Okay. Thank you.